Hey, you guys, come to you live from Toronto, Canada. That's right. In Toronto, we are now celebrating Canada Day, and in just a few days, we're going to be celebrating in America Independence Day. But these two countries, being such close neighbors, have so many differences. So today, we're going to talk about the differences in the healthcare system. Want to know what is the difference in maternity care in Canada versus the US? Let's talk about it. Hey everyone, while Canada and the US are neighbors and have some things in common, they're both pretty much wealthy, well-developed countries. They also both are considered to have high quality of care when it comes to healthcare. And they're both also known to have long life expectancy, with Canada a little bit longer than the US, 77.28 years versus 81.75 years old. Very much powerhouses, do have some important and very distinct differences between the healthcare systems. This topic is important because we know that over 50% of Americans have reported that they do not understand how insurance companies work. And in the US, if you don't understand how insurance companies work, you probably don't understand how the whole healthcare system works, as insurance companies are the primary insurers, or the majority of insurers for most Americans. In fact, in the US alone, there are over 1,000 private insurance companies. That's a huge amount. On the other hand, the majority of Americans feel that the healthcare system has failed them in some way, over 70%. And in the latest years, we've known that there is a growing number of Americans who prefer or may even consider a single payer system. So let's compare Canada, which is primarily, not exclusively, but primarily a single payer system, to the US's current healthcare system. One of the things we know that in the US, you can either be insured by the federal government funded program, such as the Medicaid program that's available throughout the states, and may have some variation in terms of what services are actually provided state by state. And then you have Medicare for our elderly or otherwise abled Americans. And then you have the bulk of Americans who are insured through private insurance. And the majority of Americans will be either co-payers with their employers or solely covered by the employers. The challenge with the healthcare system in the US is for that working poor class. So the working poor class oftentimes may not necessarily have jobs that provide health insurance that's paid by their employer, and may not be able to afford the competitive pricing of private insurance in the US, leaving them sometimes without any insurance, which leads us to the devastating effect on the healthcare system. In Canada, however, the system is slightly different. And most people will assume that in Canada, healthcare is free. And that's not exactly the case. In fact, Canadians pay for their healthcare through taxes. And the government funds a government program that provides insurance for Canadians. Through that program, they receive all of their services that are necessary for their care. And most of those services are provided through what's considered general practitioner. In the US, we will refer to them as primary care clinicians, but it's all the same. General practitioners are your family-based practitioners that provide your preventive care and your basic health care. In Canada, also, you do have the option of using private insurance, and there are a handful of private insurance, but clearly nothing near the extensive list that's available in the United States. For the most part, the private insurance companies provide services that may not be provided by their federally funded or government-funded program. In Canada, you see your general practitioner, and then you're referred for specialty care to a specialist. You have to pretty much go through your general practitioner to get to a specialty services. Whereas in the US, it really depends on what type of insurance you have. If for those who have HMOs, that process may seem very familiar. For those who have PPOs in the United States, they have the ability to go directly to specialty care. The downside of this particular system that's used in Canada is the fact that there is complaints of extended wait times to be able to see practitioners and delay in care as a result of that. And matter of fact, in both countries, people pretty much complain about the same thing: long wait time to get care, high costs, specifically for Americans. In Canada, the government doesn't own any hospitals or employ doctors. In the US, up to 50% of clinicians are actually employed by a group practice or by a hospital. What they do share in common is that both countries are experiencing shortage or an issue when it comes to general practitioners. In Canada, though there continues to be an adequate supply of physicians, the trend is more towards the specialties as opposed to general practitioners. In the US, there is a grave concern for a growing shortage of physicians. And this is not all due to COVID-19. In fact, the shortage of physicians had been predicted even before the pandemic and has been known for specific fields, including my field of OBGYNs. A recent Time article published in 2022 quoted the Association of American Medical Colleges as estimated by the year 2033, which is not that far away, there can be potential up to 34,000, upwards to 139,000 physician shortage. That's a very large number. And unfortunately, for individuals in rural communities and those who are in underserved urban communities, this is not a new issue. And unfortunately, those communities in particular will continue to see a tremendous shortage and decreased access to healthcare. Given this prediction, other communities across the entire United States will also experience this ongoing shortage of clinicians. And the shortage of clinicians will be seen in very critical areas. As I mentioned, we have a growing shortage of women's healthcare providers, specifically OBGYNs. But also it's predicted that we will continue to see a shortage in specialty fields that includes neurology, pulmonology, psychiatry, and critical care, and partly due to the growing complexity of the care of Americans. So we're pretty much becoming a sicker society. Despite the fact that we're living longer, our diseases and medical conditions are becoming way more complex. The pandemic certainly did not help this, as more individuals who were pre-pandemic considered to be healthy as a result of COVID now have long-haul symptoms or conditions, subsequent morbidities as a result of having COVID-19. But this is not all due to COVID-19. I want to make sure that that's very clear. The most devastating part of this shortage is the growing shortage of primary care clinicians. And this, as mentioned, preceded the pandemic. There are very few clinicians going into primary care, into the primary care field, which is otherwise known as general practitioners. COVID-19 placed a strain on an already strained healthcare system, and it further increased costs and it increased burnout amongst clinicians. But these conditions and these dissatisfaction with the field had been pre-existing. In fact, also the compensation between Canada and the United States for clinician is drastically different. In the US, the average salary for clinicians is almost half the starting salary, the average salary in Canada. So drastically different. So compensation is lower and burnout and dissatisfaction and cost is higher. The cost of healthcare per person in the US is estimated to be around $12,000, whereas the average cost of healthcare per year in Canada is averaged to be about $8,000. Some resources will say 7 versus 10,000. Clearly a lower cost in Canada compared to the US. But this is to make clear that healthcare costs in both systems is just a lower cost per person in Canada compared to the US. In Canada, there are also way more general practitioners per capita versus that in the US. In matter of fact, half of the clinicians in Canada are general practitioners, where only a third of clinicians in the US are considered to be general practitioners. Also important to know that cosmetics and dentistry are not covered services under the government-run program in Canada. And also important to know that within Canada, each province may also provide slightly different services. And the provinces are kind of the equivalent of almost states, not quite exactly, but almost states in the US. So different territories within Canada may have slightly different medical services provided. In Canada, just as in the US, racial disparity is considered to be a problem. Although I couldn't quite get a good sense of the impact of racial disparity in the healthcare system in Canada, it has been known that specifically the Indigenous people are considered to have poorer health outcomes than the average Canadian. Well, while in the US, as you guys know, multiple minority groups are considered to have poorer health care in the US, specifically, again, Indigenous populations, Black Americans, and Pacific Islanders, as well as the ethnicity of being Hispanic, tend to have more healthcare disparities in the US. Now, in terms of the percentage of doctors, I try to get a good sense as to how many Black doctors existed in Canada, and it's really interesting. I could not find a good resource for that particular statistic. So it's quite interesting that Canada doesn't really obviously report that information. We want to know, Canada, how many Black doctors do you have? What's the percentage of Black doctors? I was able to find it for one province. So Ontario does report that they do have about 2%, I think it's like 2.6 or 2.8% Black doctors, which is an underrepresentation compared to the amount of Black people in the population. So I was able to get a little bit of information. In the US, we know that the percentage of Black doctors is 5.7%, and we are experiencing a decrease in the Black male physicians and a continuous low number of Black female physicians. Clearly, 5.7% is below the representation of Black people in the population. So we have an underrepresentation in healthcare of Black clinicians. I do want to make clear that this is also pretty consistent with other areas of healthcare, whether you're a physical therapist, a psychotherapist, whether you are also a midwife, and all those other allied fields do experience underrepresentation as well when it comes to people of color. As we know in the US, Americans pay into our healthcare system by paying copays. And copays vary depending on the insurance and depending on the state, as well as through our deductibles. And there's logic behind if you have chronic conditions, whether you should go for high versus low deductible versus high copay, low copay. We'll get into that maybe another time. But overall, I do want to make the point that the cost of healthcare is one of the top causes as to why people have to file for bankruptcy in the United States. Interestingly, in Canada, they try to create some level of equity. So those who have higher income tend to pay higher taxes towards their healthcare system, and those with lower income pay lower taxes towards their healthcare system. So they do try to balance out some level of equity. There are reports that there is that poor populations do experience some level of disparity in Canada through their relatively single-payer system. It's also of note that in the US, we do tend to spend a considerable amount, but there's still a need for additional supportive social programs. So Canada spends less on social programs. They put less into early childhood education programs, parental leave, as well as support services for single-parent households. So what does this all pan out to internationally? What does this all mean? We know that Canada ranks above the United States when it comes to quality of care. But that ranking, don't make the assumption that they're close together, because there's still a huge gap between the two. We know that the US ranks last when it comes to access to care, administrative efficiency. Can we all talk about that part? Equity, as well as healthcare outcomes, but ranks number 2 when it comes to preventive services. So we do really good with screening and immunizations, but so many other aspects of healthcare is lacking in the United States. So what countries are really doing well? We know that amongst the developed countries, that the countries that are considered to have the best healthcare system include Norway, the Netherlands, and Australia. In terms of health outcomes, the primary cause of death in Canada is cancer, followed by heart disease, and then followed by COVID. Whereas in the United States, heart disease for both men and women remained the top cause of death, followed by cancer, followed by COVID. So you guys know I could not do this topic without discussing some differences between the maternal healthcare system in Canada versus the United States. So in both countries, maternity care is covered through insurance. And we know that in Canada and the United States, women pretty much have the same complaint. The fact that they're experiencing long wait times, they don't want excessive wait times, and they do not want to rush to appointments. So this has been an ongoing issue for both countries. We know that in the US, for the most part, depending on the system that the woman is receiving her healthcare through, she may experience an initial appointment that includes her history and her physical exam that may be anywhere from 15 minutes to 30 minutes, depending on the system that she's in. And the system determines, for most physicians, it is an administrative system that determines the amount of time that is spent with each patient. And for her follow-up visit, she may have a visit that's anywhere from 10 minutes to 20 minutes, depending again on the system and what's being done at that visit. The ongoing concern and complaint of the far majority of women in the US is the fact that they feel that they have excessive wait times for their visits, and the fact that they feel that their visits are rushed. So you wait long, you get in, you have a quick visit, and oftentimes not getting your questions answered. This is, again, part of the ongoing struggle when it comes to the maternal mortality crisis that we're dealing with in the US. And that being said, let's talk about that part. So in the US, we know in 2020 that the number of deaths have continued to rise from 2019 to 2020 to 2021 and 2022. So in 2021, we know that there were 1,205 deaths reported, and that equated to 32.9 maternal deaths per 100,000 live births. So keep that in mind. When we calculate maternal mortality, we're talking about live births. In Canada, to give you some perspective, in the last 10 years, the rate of maternal death has been somewhere between 4.5 to 8.7 deaths per year. To put this even more into perspective, remember I said in 2021, the US experienced over 1,200 deaths, maternal deaths. Well, in Canada, it's reported that only in the span of 2000 to 2020, so we're talking about over 20 years, that there have been only reported 523 maternal deaths. Just to give you some perspective, that is, again, 4.5 to 8.7 deaths per 100,000 live births. A huge difference. But there's a little bit caveat to that. So there's been some criticism by the WHO that Canada may in fact be underreporting their numbers, and that the WHO, the World Health Organization, believe that Canada's numbers may in fact be even upwards of 60% higher than what's reporting. And that would move Canada from the ranking spot in terms of who has the highest maternal mortality. And of course, no one's taking the US spot, unfortunately. The US continues to be number one in developed countries. Second is Korea. But if we adjust these numbers based on the WHO reporting, then Canada will move from the number 7 spot to the number 3 spot. And the criticism is that the data collection is flawed, and that there's some inconsistency depending on the province as to the reporting of maternal deaths and the adequate reporting on death certificates. And so in fact, the numbers may actually be a little bit higher. Internally, there's some criticism in the system also that even with the 60% increase, they're going to still be under the US, right? There will still be a lower number of maternal deaths compared to the US. But the biggest complaint in Canada has been that there's really no good tracking and studying of it. There's no system in place that that looks at these maternal deaths and looks at the information obtained and the data obtained to then intervene and change the process and ultimately improve the outcomes. There's no effort towards to then look at that maternal mortality outcome data and with the hopes of decreasing those adverse outcomes. Where in the US, we're clearly far behind what we should be doing with such a crisis. There are now multiple either grassroots efforts or government efforts like the CDC level of risk project or the Hear Her project that are geared towards trying to improve these outcomes. And of course, the Momnibus Act, which we all should be supporting, that is yet to be passed. But there are visible efforts towards looking at this data and looking at the interpretation of this data with the hopes of creating systems and processes that will improve these outcomes. So in the US, we've had primarily individual appointments with recent growth of group appointments. In Canada, you can also have very similar experience where you have individual appointments or interprofessional teams to group appointments. The other trends that we've noticed is, of course, the increase of IVF services in the US and an increase in IVF babies in the US significantly. Still, there is no federally funded program that supports fertility services. It does vary state by state whether or not the Medicaid program will provide some type of support services or coverage for IVF or infertility evaluation. So to keep in mind, some states may cover infertility, but not necessarily cover the treatment or IVF procedures. Whereas there are some states that do cover both, and we covered this in a previous video. So there are variations, and there are multiple states that don't cover anything when it comes to fertility evaluation or infertility evaluation and IVF or ART. Across the states, you will have either some, all, or no coverage when it comes to fertility, infertility evaluation, or IVF services or other aspects of ART. In Canada, IVF treatment costs average about $10,000 to $15,000 per cycle, which is pretty much similar and on par with the costs in the United States as well. In Canada, there again is no federally funded program to support IVF services or ART. And so artificial reproductive technology. And so you will see some provided based on some provinces will either provide some funding for IVF services or may actually give a tax credit for those who are undergoing IVF procedures and services. The other trend that we have noticed in the US is the increase in doula availability and access and support as a result of the maternal health crisis. In Canada also, they have in the last 10 years also experienced a dramatic increase in doula services. So the pay for doulas in both countries are pretty similar. In Canada, it can range anywhere from $40,000 per year to $65,000 per year. And in the US, it's averaging about $40,000 to $50,000 per year. In Canada, the cost of a doula can be anywhere from $600 to $1,000. In the US, it tends to be around about $1,000. I know in California, the Medicaid program does reimburse doulas, which again are non-clinicians in both countries, the same amount as a OB will get for a vaginal birth. So they get pretty well compensated in California specifically. But that does vary from state to state, whether or not the Medicaid program will reimburse for doula services. We know that in the United States, doula services have been shown to improve outcomes in low-income communities. I do not have the outcome in Canada, whether or not doula services have been shown to do the same, but clearly the trend is towards the use of doulas. So there must be some, whether well-studied or not, there must be some implication. There is some implication that there are benefits noted to having doula access in Canada as well as there is in the United States. So I also wanted to look at the C-section rate in both countries. We know that in the US, the C-section rate is 32%. In Canada, the C-section rate is 28 to 29%. Do you guys want to know which countries have the highest C-section rate? In fact, it's astounding the rate of C-sections in certain countries. Over 50% of women in certain countries will undergo a cesarean section, and this includes the Dominican Republic, Brazil, Cyprus, Egypt, and Turkey. And in Europe, the primary country is Romania, under 50%, but still very high. So it's astounding the rate of C-sections in certain countries, but the United States and Canada, for the most part, have very similar or very close C-section rates. So I hope this information gave you some insight on two very distinct systems, two neighbors having very distinct healthcare systems, Canada versus the US. Now that you have some insight as to how both countries' healthcare systems operate, the cost of the healthcare system to the individual and to the government, and the access to healthcare in various populations as well as representation. And then we took into account how both countries fare when it comes to other developed countries, how these countries rank in various aspects. And we also considered what the women's healthcare experience is like for maternity care. What are your thoughts? What system do you think are better? Is one better than the other? What areas do you feel need to be improved in the healthcare system that you're currently in? Share with us below. And don't forget to comment, like, and share as always. We thank you for watching this episode of My Healthy Bump Club, and we thank you for being a part of our community.
Thank you guys for watching. That is Dr. T, the hand behind the handle of Healthy Bump Club. Thank you guys for watching. Make sure you check out our other videos. And when you're done there, if you want to support us, you can do it three ways. One, you can directly donate. Two, you can support our apparel line called HBC Village. And then three, as always, you can use our Apple link. We thank you guys for watching this episode, and make sure we see you in the next episode.